The session will start shortly. Please remember there will be a recording and a live stream to our Radin Mas constituency Facebook. So please don't review any personal or private details. And please also mute your mic while the nurses are presenting. Only unmute when you need to speak. Okay, nurses can start.
Hello, good afternoon, everyone. I hope you all had your lunch.
Yes. Yeah.
Yes, that's good. Okay, so today we will be inviting Nurse Sri Ratina and Nurse Christina to share with you more about today's health topic, which will be on liver-related health topic. Over to you, nurses.
All right, thank you. Good afternoon, everybody. Okay, I know it's post-lunch. Everybody a bit sleepy, tired. Guys, so my name is very mouthful. Just call me Tina, and my colleague is Christina. I can call her Kiss. Okay, we'll start now. I'll share screen. Hold on. Right, you can see, everybody? Can see, Okay, so technically, let me start. So yeah, so today's topic is about liver disease, gallstone, bladder stones. Yeah, so it's in English, So myself is Martina, with my colleague is Christina lah. And so basically, we're gonna look through your digestive system, urinary bladder lah. Okay. So before we start, right, I want you to do certain things for me. We're going to do a technique we call meridian therapy. I don't know whether you guys remember the last time when I gave a talk, we have this tapping to be done. So I'm going to unstop I'm not going to show screen. Okay, so we're going to do, you guys just follow. You guys want to take photo, is it? Okay, wait, take photo first. Wait, Go back. Okay, I'll give you 3 seconds. Can take this photo. Okay, so these are the tapping points that we're going to do together. Yeah. Okay, I stop now. So you guys gonna see me, myself, and Christina. So we're gonna start with tapping. Before that, let me just play some music. So this tapping, right, is actually more like relaxation. So that you know when you guys are stressed or overwhelmed, you guys actually can do this together lah. Okay, so first we do a tapping. You guys follow. Your hands up. Okay, you're gonna tap over your head. So whatever stress, whatever anxiety that you guys have, tap it away. Say go away. Tap, 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 tap. Whatever problem, all this COVID-19 situation, just tap it away. Okay, tap, 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 tap. All right. Okay, then the next one is beside your eyes here. Tap over here. Eyebrow here, below here. Tap. Okay. 10 times. Very good, doing well. Release your stress, anxiety away. Next one is beside your eyes. Tap beside your eyes together. Very good. Whatever problems you have, for 1 hour, we'll take it away for a while. Okay. Well done. Next is below the eyes. Tap it away. At the same time, try to remember the problems that you have. By tapping, try to remove the problems away for a while. Okay. The next is below the nose. So below the nose here, tap over here, tap. Good job. Okay. After that, below your chin, tap it away. Whatever problems you have, it's going to disappear for a while. Okay, next is tell yourself it's going to be okay. Tap your chest. It's going to be okay. Now, last time, our parents, when we small, we cry your parents that here, right? So it's actually there's therapy indicated that it helps with anxiety and stress. Yeah, tap, 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 tap. All right, last, let's go over here. Start here, the hand right in the step. Yes. As you can see, in the other hand, you can see So yes, how you guys feel? Better or not? Tap all the parts of the body. Okay, now we're going to start the topic. Alright. You guys can hear me clearly? Okay, so anybody, before this, I want to ask. You guys know where's the liver? So basically, okay. So the liver, right, it's actually part is near the abdomen area lah. Okay, so the biggest organ of your body. Yeah, it has a lot of nutrients, a lot of what's that called, sources lah. So is inclusive of connective glands and liver, the gallbladder, the pancreas. Is on the right side of our body. Okay, the largest organ in our body, and it produces many substances like bile, greenish fluid that help with digestion of fat. Bile and liver store in a small pouch. You can see here, right, the green color bile, which we will discuss a bit later. It's called the gallbladder, where we release a small intestine during meals. Yeah. Okay. So now, right, we're gonna watch a video of the liver. Hold on. And I'm gonna watch this. You guys can see.
The human digestive system includes several connected glands: the liver, the gallbladder, and the pancreas. Located on the right side of the abdomen, the liver is the largest gland in the human body. Large blood vessels, the hepatic artery, and the portal vein bring it the quantities of blood that give it its dark red color. The liver produces many substances, including bile, a greenish liquid that facilitates the digestion of fat. Bile produced by the liver is stored in a small pouch, the gallbladder, then released into the intestine during meals. The pancreas, a long gland located under the liver, also contributes to digestion by secreting digestive juices that help to decompose foods. The liver and pancreas thus play an essential role in digestion. They also play other vital roles. The liver, for example, stores large reserves of sugars and vitamins.
All right. So if you can see, I just do a recap. Okay, your liver is the largest organ in your body. It contains there's a lot of storage lah in your body as well. It has helped with your digestion. It will help with your bowel formation, especially digestion of fats. Yeah. Okay. So now, what do your liver actually do? It acts as a filter. From the video, you can see, right, it actually filters the good substance and detoxify the bad substance. It'll help to process food, as mentioned, especially fatty foods like help to process, help to build muscle, and digestion as well as help. So one of the liver function, actually, if there's bleeding, right, the liver will actually stop from the bleeding from occurring. Yeah, and then it helps to kill the germs and of course detoxify substance that's harmful to your body. Okay, so then, right, how do our liver work? So from this video, we're going to actually see, right, functional system of your liver, small information. Okay, another share screen of another thing. Hold on. I'm going to see this one.
There's a factory inside you that weighs about 1.4 kilograms and runs for 24 hours a day. This is your liver, the heaviest organ in your body, and one of the most crucial. This industrious structure simultaneously acts as a storehouse, a manufacturing hub, and a processing plant. And each of these functions involves so many important subtasks that without the liver, our bodies would simply stop working. One of the liver's main functions is to filter the body's blood, which it receives in regular shipments from two sources. The hepatic artery delivers blood from the heart, while the hepatic portal vein brings it from the intestine. This double delivery fills the liver with nutrients that it then sorts, processes, and stores with the help of thousands of tiny internal processing plants known as lobules. Both blood flows also deliver the oxygen that the liver needs to function. The blood that is received from the intestine contains carbohydrates, fats, and vitamins and other nutrients dissolved in it from the food you've consumed.
So as you can see, the livers are very important. Okay, it helps with a lot of functional like storage, glucose and nutrients. Yeah, hold on. Stop share. Okay, yeah. So it's actually the vital organ. So if let's say your liver doesn't work, right, actually the whole body doesn't work as well. So let us take a look, right, on why or causes of actually liver disease. Okay, so one of the important information that we know that excessive consumption of alcohol do causes liver failure because number one, it helps to filter the good one they keep in the body, the bad one they detoxify it away. Certain viruses will also cause liver diseases or autoimmune disorder. So autoimmune disorder is like the kind of disorder that will attack normal healthy cells. Unhealthy diet. So why unhealthy diet causes liver failure or liver disease? Number one, if you remember the function of the liver, it helps to break down fats, right? So if you imagine if they have too much fats, right, it will actually cause the liver to overwork. Therefore, it causes liver diseases or liver issue. Yeah, obesity. Obesity means what? A bit bigger on a bigger scale. Yeah, so obesity also will cause liver diseases because you overwork your liver. To produce, so that you see your body is bigger, so your liver have to work extra hard for that. So genetic means what? Genetic means, right, it's something from your family members, like your grandmother, grandfather, like your lineage lah. So this one is something that we cannot do anything about. If it's within your genes, you cannot, it's something that is there already. So one more thing is drug abuser. So if you have stories heard stories about other people abuse drug, right, they also have higher tendency to have liver disease lah. Yeah, because of the overconsumption, because your liver filter away. So if they overuse, the overuse of the liver, of course, it will cause breakdown. Yeah. So another one is hepatitis B and hepatitis C. Okay, hepatitis B, right? It actually causes your liver to swell and actually affect the function of the liver. Hepatitis C, it is having a long term. We have risk of cirrhosis. Okay, I will show you later. There's a photo. Okay, so the next one, right, is stages of liver disease. Okay, so right, this one you don't have to worry too much. I'll try to simplify it for you guys. So this is depending on the causes. So as I mentioned, the cause has multiple causes. Everybody is different. Some goes through different stages. Some are the same across all the patient. So liver failure happens when the liver cannot work or perform the vital function. Like producing bile to help for your digestion or clearing the blood toxin substance. Okay, so the first stage, right, is actually inflammation, means swelling lah, means your liver become large or inflamed. So many people with liver inflammation doesn't have symptoms. Okay, if the inflammation continue, there'll be permanent damages. So you can see here, right, the stage 1 is healthy liver, fatty liver. Next one is liver fibrosis. So fibrosis occur when the swelling happen, then got scar. So when there's a scar area, that's where the liver cannot function properly lah. So they only can use the scar function cannot function as the same one. They only can use the healthy liver lah. Yeah. So fibrosis is hard to detect and the symptoms are not present most of the time. Cirrhosis. So cirrhosis is actually a stage where severe scarring built up from the liver because there's less healthy liver tissue. So it becomes difficult for your liver to perform properly. And while symptoms may not be present before, at this stage, right, cirrhosis, right, is where you will have symptoms. So you can see here on the picture, this is actually the real liver, where you can see actually if it's a normal liver, it will be smooth. Like you see healthy liver, very smooth, very good blood supply. So you can see the liver cirrhosis here, there's a lot of scarring. So when there's scarring, right, it's very hard for your liver to function properly. And the last stage is called end-stage liver disease, where the function is limited and deteriorated dramatically. And at this stage is where you got symptoms like swelling of the tummy, we call ascites. And sometimes it can't be reversed. And the only way you can do it, right, is by liver transplant. Yeah. Okay. So as I mentioned, from what the function of the liver disease symptoms is number 1, bleeding from nose or vomiting of blood. So if you remember, the liver function is to help blood to clot. Right. So if you have liver problem, definitely you have bleeding from the nose and vomiting of blood. Then the other one is stomach pain because of the anatomy of the liver is actually at the stomach area. Then of course you got weight loss because remember your liver function is to give nutrients out to your other part of your body. So if let's say these nutrients are not given to your part of your body, so your body will be smaller lah, means you lost a lot of weight. Of course, when you lost a lot of weight, right, be very tired lah. I mean, because you don't have nutrients, don't have energy anymore, so you'll be very exhausted. So that's why you got fatigue. So the other one very significant, right, is this thing called jaundice. Jaundice is like, you see your eyes, right? Your eyes here got white color. So the white color of your eyes become yellow. So that is a very distinct liver disease symptoms. We have yellowish of the eye. It's one of the symptoms that we take a look for liver disease symptom. Yeah. Okay, so let's say, right, if a doctor say, hey, got issue, so what a doctor will do? So just remember, whatever I'm telling you is very generalized, and remember that different patient has different issues at the same time. Sometimes it's just pure liver, but sometimes there's other multiple chronic diseases, but it's quite general. Blood test is to be given to check. So remember, the liver function is to help clotting, right? So the blood test is to test whether your liver is working properly, whether the clot take longer or not. So then they can detect like, oh, there's a problem with the liver. Imaging test means like what? No, the ultrasound, the MRI scan or the CT scan. So basically they will look through the cause or the problem. Okay. And the other one is biopsy. Biopsy is where the doctors, right, actually use a small piece of liver. It means like they poke through your stomach, then they will take a small piece of your liver cells, and then look through the microscope to see whether there's any issue with your liver. So this is like common and general diagnosis for purely liver. Just remember, is case to case. Different people have different things, but this is just general. Okay. So then treatment, right? So again, for the treatment, for medication is only, okay, so you remember one of the causes I said was the drug, right? So sometimes patients take overdose. So doctor can only reverse the cycle by giving medication so that the liver doesn't work as hard. Okay, that's supportive care. So as I mentioned by the stages, right? Most of the stages are asymptomatic. Asymptomatic means what? No symptoms. You don't have any other symptoms. Only at the later stage you can see symptoms. So supportive care is more of like treating the symptoms, and at the same time, sometimes the liver can recover on its own. Yeah. And then last but not least is liver transplant. So basically salvaging or protecting the liver that is working, and then putting a new liver, means like from another organ to your own organ. Yeah. And actually liver transplant is actually a successful. Yeah, the process is actually quite successful. Okay, so here, right, how can liver failure be prevented? Okay, so basically the very important way is to limit the risk. So as I mentioned, there's a few risks, right? We try to limit all hepatitis. Okay, so you guys ever heard before, right? When actually advertisement also got say when you cut your vegetable or your meat, right, must have separate chopping board. So that's also to prevent hepatitis B and C to occur. So get the vaccination also as that. I think you also must be aware that there's a vaccination called hepatitis vaccine. Healthy diet. Why healthy diet is so important? Remember, a lot of fat will stress on your liver, and then it will cause a lot of issues. So healthy diet, salt, don't take too much salt fats all that. Okay, then maintain healthy weight. Remember, the bigger you are, you cause a lot of stress for your liver. Okay, so try to make healthy diet. Alcohol can drink but cannot drink too much, because if you drink too much, right, when you drink the alcohol, the liver is one who will filter the good and the bad. So you overwork your liver, then you have liver damages. Of course, practice proper hygiene is what? Like before and after food, wash your hand. Don't share commonly used item like toothbrush or like the shaver or that. Don't share, use your own. Then another thing is, like say body tattoo also, try to get, sometimes some of the parlor not that clean, so make sure there's a clean area. Of course, and also drugs, I mean, this is general. Don't use illegal drugs on yourself. Okay, all right. Very, very tiring, right? Too much information, some more about liver disease. So the nurses here are gonna entertain you, but you guys have to participate. I will see you guys here. So basically, you guys must be in a seated position, sit down position. Sit upright. Okay. And then right, you need to help me follow our movement. Can everybody okay? Give me a moment. Let me just. Okay, everybody ready? Okay, so basically this movement, right, is on 10 steps. So means 10 times. So you just follow us, then after that it'll be 10 movement. Okay. Okay, everybody ready? Let's see. Okay. Okay, everybody, let's move. Okay, sit up straight. Follow us. Follow the movement. Okay, done. Okay, done. Okay, so we go back because you know why? Very, very long lah, this topic, a lot of words one. So we want to break it up a bit so that you guys are a bit awake. So the next topic, right, is actually gallbladder. Will be given by Christina. Give me a moment, let me just share screen. Hold on.
Okay, thank you, Tina. So now we watch a short video for a while about gallstone.
Gallstones are small stones, usually made up of cholesterol, that form in the gallbladder. In most cases, they don't cause any symptoms and don't need to be treated. However, if a gallstone becomes trapped in a duct or within the gallbladder, it can trigger a sudden, intense abdominal pain, which usually lasts between 1 to 5 hours. This type of abdominal pain is known as biliary colic. When gallstones cause symptoms or complications, it's known as gallstone disease or cholelithiasis. So, what are the signs and symptoms of gallstone disease? Most common symptom is biliary colic, which occurs when a gallstone blocks one of the bile ducts or the gallbladder. Biliary colic doesn't occur often. After an episode of pain, it may be several weeks or months before you experience another episode. In addition to biliary colic, some people also have periods where they sweat excessively and feel sick or vomit. Other symptoms may develop if the blockage is more severe or develops in another part of the digestive system. Some people with gallstones can also develop complications due to inflammation in the gallbladder, persistent pain, jaundice, and fever. Some other symptoms of gallstone disease include diarrhea, chills or shivering attacks, confusion, and loss of appetite.
Okay, we're gonna stop from here. Christina will actually explain a bit further. Okay.
Okay, so from the video, let me recap. So the function of the gallbladder is to store bile and release bile into the intestine, and also helps to digest fat and at mealtime. And if the bile is produced by the liver, and if the gallbladder is surgically removed, the liver will continue to produce bile, in which similarly flows into the intestine. All right, next. So gallstone. So gallstone generally refer to stone. They are found in the gallbladder. Gallstones form when the amount of bile in the gallbladder become unbalanced. When this happens, some of the chemicals become solid and form stones. And usually gallstones is usually made up from cholesterol that form in the gallbladder. Right, next. So gallstone symptoms. Usually, gallstone doesn't have symptoms, but discomfort after eating, especially with fatty food or high-fat diet or fast food, severe cramping pains over the middle and the right of the upper abdominal area, fever, which also can associate with infection, and jaundice, like what Tina have earlier on explained, the yellowing of the eyes. Okay, so gallstone diagnosis and treatment. Gallstone diagnosis, it can be done by ultrasound, CT scan, or MRI, which is a scan is necessary to confirm the gallstone or to detect the gallstone. Usually ultrasound is performed. Stone may be detected on the CT scan or MRI from the abdomen and the images. And gallstone treatment, no symptom, which means usually don't need any surgery. But if you have symptoms, the gallstone, like severe pain, the symptoms such as severe pain, it could be infection or obstruction, and it might need surgery. Next. So do you know where's our bladder located? Right. So the bladder is located in between our kidneys and is made up of muscles. The role of the bladder is to collect and empty urine. It's like a storage or a container that holding up the urine. Next, please. How does bladder stone form? You can see this is like the small pieces. Bladder stones are hard lumps of mineral that can form inside the bladder. If the urine sits in the bladder for a long time, it will have a chemical. The chemical in the urine will form crystals which harden the bladder stones. What causes urinary stones? Not drinking enough water, certain medical conditions, hypothyroidism, like such, and not enough calcium intake, such as milk or cheese. Okay, so how do we prevent bladder stones? Early doctor review. If you have unusual urinary symptom, then you need to drink a lot of fluids for dehydration. For hydration, and need to drink at least 2 to 3 waters if no restriction or any fluid restriction, and to moderate calcium intake and lower the salt and animal protein intake. So if you have urine stones, how is it treated? So most small stones are passing out during passing urine. The larger one can be treated in several ways, such as shockwave or small operation. From the shockwave, it treated is a painless procedure, and you need it to not only one session, you need to go for a couple of sessions in order for the big pieces of stone will be fragmented or to a small pieces where you can passing out via passing urine.
Okay, so we're gonna end our session. So now, right, it's actually question and answer session. Do you guys have any question and answer? Question. Any question that you want to ask us regarding about these 3 topics that we've given today? If there is, please inform. Please ask.
Okay, may I ask what causes urinary tract infection?
Oh, UTI, okay. It's not within the topic, but I can answer you. Okay, so UTI is caused by multiple factor. We need to find out, need to diagnose, but most of the time, right, it's actually hygiene lah. Most of the time it's hygiene, because actually after urine, we actually need to wash, okay? Sometimes, right, when we actually wash, especially for female has higher risk of having urinary tract infection, because our urine and the anal is actually quite near lah, yeah? So that's why we have higher risk as compared to the male. However, if let's say the male participant would have UTI, is much more serious. Yeah. So actually, washing thoroughly also is very important, especially when you clean up. Right? You have to clean from the front to the back, and not the back to the front. Get it? Bit visual. Yeah. So naturally, but then if let's say frequently you have urinary tract infection, it's best to get the doctor to review you, because we're not sure whether there's any issue within. Yeah. Because if let's say we always have, right, then you will have a lot high risk of having viruses, or yeah, need to get doctor to review lah. Does that answer your question?
Okay, thank you.
Welcome.
Hi.
Hello.
I would like to ask
Sure.
about fatty liver.
What do you want to know about fatty liver?
I mean, can we how to eliminate away the fatty part?
Or eliminate, okay. So technically, right, at this junction, because you remember the function of your liver is actually to filter. So if let's say in your dietary, if let's say now you already have fatty liver, it's good actually to get the doctor to review you, number one. Number two, diet lah. Your diet must really ensure that you restrict your amount of fats, especially fats, all these compromised salty intakes you have to reduce, because fatty liver is actually most of the time due to our diet and our lifestyle. Yeah, and of course, lifestyle is the most component. Yeah. So if let's say you have fatty liver, you consult your doctor. A doctor will have certain prescribed medication to give it to you. But generally, your dietary monitoring is very important. So as I mentioned, the function of your liver is actually to so-called breakdown of fats by through our bowel. So if let's say you overload with a lot of fatty substance, eat very, very nice food, right? Then there'll be consequences for your liver.
Does a blood test, can you check out for the fatty liver?
Sure, there is tests that can check for fatty liver. If let's say you got family history, right, so it's better to get it checked lah.
Okay, thank you.
Sorry, but I understand a very skinny person also can have fatty liver. If the person don't have a lot of fats, then what causes the fatty liver? Can it goes off? If let's say you lead a healthy lifestyle and you exercise and your intake of food, you be mindful, will the fatty liver goes off?
Okay, so some patient that is skinny also have hypertension, also have high cholesterol. So doesn't mean that you are not obese. Inside your body is healthy, Yeah, so that's why dietary is very important lah. Very important, irregardless of your size, right? Your intake of food, diet is actually quite important. And there's a lot of patients who are very skinny, also have cholesterol that is high, also has hypertension as well. And of course, most of the time we always blame it on the obesity, right? But actually not true also. So you mentioned whether can remove it, okay, so you really need to look through, because as I mentioned, right, for this condition, have multiple causes. Not really one patient is the same. Some it is genetic. No matter what you do, you still have it. Like some patient also very take care of themselves and stuff like that, but then still genetically have hypertension, then they also have high risk. But the good thing is that once you already know that you have high risk, you try to limit and try to decrease the amount. Then hopefully that it will become it'll be better lah. Yeah.
Okay, I have a question on liver cirrhosis.
Liver cirrhosis, okay.
Yeah, what is the cause? Because this person doesn't drink alcohol or this, but what's the cause of liver cirrhosis?
Understand. Okay, so remember our stages of liver disease, the slide, right? I've shared with you guys. Let me just go back. Yeah. So right, liver can go through different stages. Actually, there's 5 stages of liver damages. Stage 1 is actually inflammation, then after that fatty liver, then fibrosis, then cirrhosis, almost the end. So how this cause, as I mentioned, sometimes even if you take, you've never drink, sometimes dietary, unhealthy diet, weight, then drugs, substance, sometimes genetic, virus, autoimmune. Yeah, so multiple causes lah. So as I mentioned earlier part, when I go through this slide, right, it's actually see what are the things that you have. Yeah, so at liver, like this cirrhosis level, it's actually quite at the almost the end stage, whereby the scarring has happened. Like you can see it from the photo here, it's no longer healthy, because healthy liver, right, is actually pink and very clean and smooth. If you can see from the picture here of the real liver, it's actually quite, like orange peel, not even smooth really, because there's scarred tissue. So when there's a scarred tissue, your liver function, right, the one that's supposed to remove toxin, that's supposed to help your digestion, all that cannot function anymore. Yeah. So different people have cirrhosis for different things. Sometimes viruses also can help. That's why very important.
Could be virus, I mean, could be caused by virus.
Very important. That's why when I
if like like to eat fatty, fatty food also can cause it. Is this equivalent to cancer?
It's not equivalent to cancer, but the condition is also quite severe because it's come to the stage. Like cancer has stage, right? This liver damage have stages. So apparently, cirrhosis is almost like stage 4. Then 5 is whereby you need to have a transplant, means change of a new liver.
So the symptom is bloated stomach.
The symptoms can be quite different from one person to another, but majority is bloated stomach, correct? Sometimes you can see the stomach, right, like got water like that. Then the eyes can be a bit yellow also. Yeah.
The treatment is to tap away the water, is it? Because cirrhosis is a lot of fluid.
Yeah, the cirrhosis that you said, the tap water is actually abdominal. So cirrhosis is actually your liver. Yeah, so that's why I say, like, in terms of the treatment, we need to know the causes of the patient first. So when I share with you guys, it's actually general. Yeah, because sometimes some people got other condition, like they have other things that might cause this as well. There might be hepatitis C, hepatitis B also.
So could be the hepatitis also.
Can be a few things.
Thank you. Yeah, thank you.
No problem. If no more questions, right? You guys got any more questions? Then we can do last. We do an exercise activity, the same one, if you guys like. Any more questions? How long does hepatitis B vaccine? Okay, I saw on the chat box here. How long does hepatitis B vaccine last? Okay, so technically, right, you have to get your vaccine at least 10 years or so. So if let's say last vaccine was done quite long ago, you better get the doctors to see whether that can renew, so-called can re-inject lah. Yeah, because I cannot say on really how long per se, because it's really based on what you have, like chronic disease and stuff like that, and your risk. Because I know if let's say you are like very with food or whatever not, then they'll like if you're doing food or cooking or whatever not, then there will be a range for you guys also. Another question. Okay, can. Yeah, any more? Okay, if you have, we do it.
Excuse me.
Hello.
Can I ask the for the first image after the video on the gallbladder's image? Can you please show it to me again? I want to take a photo.
Oh, the video, huh? You want the video?
No, after the video.
After the video.
After the video, you show various slides. The first slide, please.
Hold on, let me go through. You tell me to stop, huh? This one? This one?
No, earlier.
This one?
Yeah, that's right. Just 1 minute. I take this photo.
Sure. Go ahead.
Okay, thank you.
Welcome. Any questions for me?
this how do we know we have gallbladder or not?
Yeah,
Gallbladder
so
stones
that's
or not?
why, yeah, so this one quite tricky also because you know some of it no symptoms. So normally, right, when you have gallbladder, the doctor will not do anything unless there's symptoms. Yeah, because then if there's symptoms, then they will do certain operation or treatment lah. But generally, it's supposed to remove on its own. You see, yeah. So technically,
so if that-
the diseases that I've mentioned today, most of them has little symptoms unless it's on the later stage. Yes. So the
So if
symptoms,
there's,
like, yes.
so if there's no pain, nothing normal, so we assume it's everything okay lah.
Yes, correct.
And
So,
what are, may I know, causes of
sorry,
gallstones? The causes for
So
the gallstones to form, it's just accumulation of.
Yeah, so very important, right, for gallstone, right, is actually on hydration. Because sometimes if you don't remember the water, because sometimes, right, we all tend to not drink enough water. So when there's basically what happen, if let's say you don't drink a lot of water, so there'll be a crystallized formation. Like there'll be a formation then it becomes stones technically. So lots of fluid is important. If let's say you got fluid restriction, you have to discuss with your team doctor as well. Yeah.
Okay. Nice.
Okay, we will do the last last activity. Okay. Let's do it. We all enjoy to make you move a bit. I know actually by right, in 1 week must do 150 minutes of exercise, no physical exercise, no. So today we burn a bit more with us, Okay, we do a bit physical activity. Okay, before we end the topic, before we not see each other soon, okay, we just do this first. Guys, remember the steps, right? It's quite simple actually, very easy steps. Okay, seated position. Make sure not a moving chair. Okay, just only move your arms only. Okay. Okay, everybody, let's do this. We did it, guys.
What is
Yes,
the purpose of
yes.
this exercise?
Physical activity, your hand movement, because you guys always on the phone, right? Watch YouTube, need to exercise your hand, your wrist.
So this help the movement. This movement will help what strengthen the liver.
No lah, don't have. I wish there's an exercise for a liver, but no.
Is that exercise for the liver?
No, exercise our mouth.
Exercise your mouth. You talk with
Try to limit your food intake. Okay, fatty food, high in salty intake, all that lah. Huh?
Hi, is this an Indian song and Indian dance?
It's an Indian song. I think we just do the dance ourselves, not an Indian dance.
Yeah, very fun. Thank you.
No problem. I'm glad you like it.
Thank you.
Yeah, if that's all, then I think we finish our presentation already. Thank you, everybody.
Someone who requested for a run through of the slide.
Run through, huh? Just go through, is it?
Yeah, just a quick one because that on the chat group.
The recording is done on our Radin Mas Facebook constituency, so you can just check the recording. Don't need to trouble the nurses to rerun everything again. Again, if nurses here can end already. Thank you.
Thanks. So the recording we can watch from Facebook, is it?
Yeah, correct.
Radima's Facebook?
Correct.
Thank you.
Bye-bye.
Okay. Thank you.
Thank you. Bye-bye. See you. Bye-bye.